Ultrasound scans can look confusing at first, like a blurry Rorschach test, but once you know what to look for, they become easy to read. In this video, I'll break down how to interpret ultrasound scans step by step, even if you're a complete beginner, so don't worry if you think it looks like a cat threw up on the screen. Okay, before we dive into reading an ultrasound scan, let's quickly understand how ultrasound works. But wait a minute, hold your horses, I'm not going to bore you again because I already explained this in another video, which is conveniently linked in the description below, so go check it out. Or don't, I'm not your boss. We will be waiting for you, like a patient in a doctor's waiting room. By following these steps and understanding the specific characteristics of each body part, you can effectively interpret ultrasound images and provide accurate diagnostic information. We definitely need to place the probe on the patient, otherwise we won't get an image, which would be silly, wouldn't it? So first, you'll want to apply a small amount of ultrasound gel to the patient's skin, over the area you're interested in. This gel helps the sound waves travel efficiently by ensuring good contact between the probe and the skin. Then, gently place the ultrasound probe on the gel-covered skin, adjusting the pressure to maintain good contact without causing any discomfort to the patient. As you move the probe around, the ultrasound machine creates real-time images from the sound waves that bounce off of tissues and organs. These images are in grayscale, where different structures appear differently. For example, hyperechoic structures like bone or calcifications appear bright white, while hypoechoic structures such as solid organs like the liver will appear dark gray. And anechoic structures, like the fluid-filled bladder, will look black. Alright, let's talk about ultrasound, but without making it sound like a boring textbook, shall we? It's like trying to understand why your phone takes such great pictures. First off, we have these things called acoustic enhancement and shadowing. Think of them as the lighting tricks of ultrasound. Enhancement is like a spotlight behind a fluid-filled area, making it look extra bright and showing us stuff like cysts. Shadowing is the opposite, creating a dark zone behind something solid like a gallstone. It's like when a rock casts a shadow on a sunny day, making it easier to spot. Then we have frequency and resolution, the dynamic duo. Low frequencies are like the bass in your car, they go deep, perfect for looking at things like your liver. High frequencies are like your phone's camera zoom, great for seeing details in shallow areas like muscles. It's like comparing a wide-angle lens with a telephoto one. Resolution is all about how clear the image is. Axial resolution is how well we can see things in line with the sound waves, and lateral is how well we can see things side by side. Finally, there's focus, which is like adjusting your camera to get the perfect shot. It makes sure the image is sharp right where we need it. Adjust the focus. It's like putting on your glasses. Everything just looks better. Okay, so now that we've got the basics down and you've tweaked the machine to perfection, we can finally get to the good stuff, looking at actual body parts. Think of it like having all the ingredients ready. Now we're finally cooking. These tips and tricks we just talked about will help you figure out why everything looks the way it does and how to get the best picture possible. Ready to see what's on the menu? All right, let's dive into the belly, shall we? It's like going on a treasure hunt, but instead of gold, we're looking for livers, gallbladders, and other fun stuff. First stop, the liver. It should look like a smooth, medium gray blob. If it's too bright, it might be getting a bit fatty. If there are dark spots, those could be cysts, or something more serious. Cysts often have this cool spotlight effect behind them, thanks to that acoustic enhancement we talked about, which makes them easy to spot. Next up, the gallbladder, which is normally a black, fluid-filled sac. If you spot bright things inside casting shadows, those are gallstones, like little rocks hanging out. If the walls look thick, that's probably inflammation, like the gallbladder's throwing a tantrum. Now the kidneys, they look like little beans. The outer layer should be darker, and the inner part brighter. If you see black round spots, those are likely cysts, nothing to worry about. But bright spots with shadows? Those are kidney stones, those little troublemakers. And if the central part looks all stretched out, that might be a blockage, which we call hydronephrosis. The pancreas is a bit of a hide-and-seek champion. It's tucked way back there. When you do find it, it should look pretty even. If it's big or has dark patches, that could mean pancreatitis, which isn't very fun. And if you see a mass, it's time to call in the experts. Lastly, the spleen, which is like the liver's slightly darker twin. If it's too big or has some weird spots, that could be a sign of infection or something else. So there you have it, the abdominal tour. Ready for the next stop? Let's dive into the world of the pelvic ultrasound, where we get to peek at your insides. First up, the bladder, which, when full, should resemble a big, black, liquidy balloon. The kind you wish you could fly away with, but, it's filled with something else. If we see some weird lumps or the walls look thick, it's like the bladder is trying to tell us a story, and it's not usually a comedy. Next, the uterus, which should have a smooth, pear-shaped vibe. If we spot lumps in the wall, those could be fibroids. Basically, your uterus decided to grow some tiny roommates. And if the lining is looking a bit thick, it's like the uterus is wearing a heavy coat, and we need to investigate further, especially for those postmenopausal folks. Then we have the ovaries, which are like small, oval treasures, often with tiny black dots called follicles. If we see a larger black area, it's probably a cyst. If it's solid or has mixed textures, that's like finding a suspicious-looking rock in the treasure chest. For the fellas, the prostate should look symmetrical and uniform. If it's enlarged or has some dark areas, it's a sign that the prostate might be throwing a party without an invitation, and it could be BPH or, even worse, cancer. And if it's an obstetric scan, we're on the hunt for a tiny human-shaped blob. We'll check the baby's size, heartbeat, and make sure everything is going according to the manual. All right, let's put on our detective hats and dive into the world of vascular ultrasounds, where we get to play Spot the Blockage. When we're looking at blood vessels, it's like we're on a mission to find any traffic jams, or, worse, blood clots. In arteries, we use Doppler. Think of it as the radar for blood flow. If we find a narrowing, also known as stenosis, it's like the blood is trying to speed through a bottleneck, and we'll see some turbulence on the screen. If the artery is completely blocked, it's like finding a dead end, no flow at all. Now, when we look at veins, we're mostly checking for clots, especially in the legs, because they like to throw little parties down there. Normally, when we press on a vein with the probe, it should compress like a water balloon. But if there's a clot, it's like a stubborn, uninvited guest that refuses to budge, and we'll see a bright spot inside the vein. It's like a little red flag. Okay, let's flex our humor muscles and explore the world of musculoskeletal ultrasounds, where we get to be body part detectives. When we're looking at tendons, they should have a nice striped pattern, kind of like a well-organized zebra. If we spot a dark gap in that pattern, it's like a rip in the zebra's stripes, and that likely means a tear. If the tendon is swollen and looks darker overall, it's probably tendinitis, which is like the tendon is throwing a tantrum and getting all red and puffy. Now, for muscles, we're on the lookout for tears or fluid collections. A tear will show up as a dark area, kind of like a pothole on a smooth road. And a hematoma, which is a fancy word for a collection of blood, will look like a black or mixed echo blob, like a spilled ink spot on your body. In joints, we're checking for fluid, a bit of which is normal, like a little bit of oil in a machine. But if there's a lot of it, it's like the joint has sprung a leak, and that usually means inflammation or an injury. We also check out the synovium, the lining of the joint. If it's thickened, it's like the lining has decided to wear a winter coat, and that might mean arthritis. All right, let's put our hearts into this and explore the world of cardiac ultrasounds, where we get to peek at the inner workings of that amazing pump. When we're looking at the heart, the chambers should be the right size, not too big, not too small, kind of like Goldilocks and her porridge. And the walls shouldn't be too thick, they should be just right. If a chamber is enlarged or the walls are thickened, it's like the heart has been hitting the gym too hard, and it could mean heart disease. The valves, those little doors in the heart, should be thin and move smoothly, like well-oiled hinges. If they're thickened or don't open all the way, that's stenosis, which is like the doors are stuck and not letting blood flow properly. If they don't close properly, you'll see blood flowing backward on Doppler, which is called regurgitation. It's like a bouncer letting people back in after they've already left. Finally, we'll check the pericardium, the sac around the heart, kind of like a protective bubble. If there's fluid in there, it's called a pericardial effusion. And if there's too much, it's like the heart is swimming in a pool, which can cause some problems. So when you're scanning, think of it as being a detective, armed with a fancy probe. You've got your basic principles to guide you. Acoustic enhancement is like a spotlight that helps you spot fluid-filled structures, like finding the secret swimming pool. Acoustic shadowing is like a shadow that helps you identify stones or calcifications, kind of like finding the hidden rocks in the pool. And Doppler, that's your super cool radar for blood flow, helping you track where the blood is zooming around, or not. You've got to adjust your probe's frequency and focus like you're tuning a radio, trying to get the clearest picture possible, because nobody wants a blurry radio show. And always correlate what you see with the patient's symptoms and history. It's like putting together a puzzle. Each piece of information helps you see the bigger picture, and the better you get at solving the puzzle, the faster and more confident you become. It's like you're training to be a medical imaging ninja. Let me know if you have any questions or want to dive deeper into a specific area. Hey, you awesome people, if you loved this video, absolutely obliterate that like button. Then, for more amazing content, subscribe to the channel and make sure to hit that notification bell so you never miss a single video. Do it now!